Why am I so depressed when my body hurts? This is a question that I constantly get. And while the answer might seem obvious, it really isn't that simple. So it's vitally important to be informed to make the right decisions with your doctor. In this video, I want to show you some of the ways that chronic pain leads to depressive symptoms and explain their intimate connection. So please stick with me to get then information about your way out. Hi, I'm Gideon from Pain.PAUSE.LIVE. I'm a psychologist and psychotherapist in Germany, and in this channel, I want to give you sound scientific information all around chronic pain and mental health. In this video, we're going to cover a short overview about what is chronic pain, what are typical depressive symptoms, when do we talk about depression, what are the factors in chronic pain that foster depression, and what can you do when you detect all these things. This video is for educational purposes only, and it's not thought as personal, medical, or therapeutical advice. Chronic pain and depressive symptoms can be very serious conditions. If you suffer from one of these or both, please turn to your doctor as soon as possible. In case of emergency, don't hesitate to turn to your next hospital or call an ambulance. Now, what are we actually talking about? Here we talk about chronic pain in regard to all recurring or constant pain states. States that are with you for more than 3 to 6 months in a row. That was easy. But what is actually depression? When we talk about depression, it's always good to look at the diagnostic criteria. For this, I take the criteria of the International Classification of Diseases, ICD-11, by the World Health Organization. And here it's stated, a depressive episode is characterized by a period of depressed mood or diminished interest in activities occurring most of the day, nearly every day, during a period lasting at least 2 weeks, accompanied by other symptoms such as difficulty concentrating, feelings of worthlessness, or excessive or inappropriate guilt, hopelessness, recurring thoughts of death and suicide, changes in appetite or sleep, psychomotor agitation or retardation, and reduced energy or fatigue. As you can see, it's a whole list of criteria that have to be met to call it a depression. For pain patients, a lot of them seem pretty normal. As we know today, the symptoms of depression can have a lot of courses. Even more so when you suffer from a pain flare-up. If you find yourself to suffer from some of the symptoms that I just mentioned, please turn to your doctor to talk about it. Today, there are good ways to help. Some of them I will talk about later in this video. To discriminate depression from just feeling down, a certain number of criteria have to be met. Concerning chronic pain, one of the most interesting seems to be here the time criterion for feeling depressed for at least 2 weeks in a row. This is so important because as pain patients, we often feel down, depressed, sad, want to withdraw as long as the pain gets worse or is really bad. But most pain patients already feel better when the pain starts to fade, isn't it? So they never meet one of the most important criteria. If this is true, technically spoken, no one is allowed to diagnose you with depression. But arguably, why shouldn't it be true if you find yourself in the same state just a couple of days later? This is a typical dilemma for doctors or therapists, which is often overlooked. While a lot of effort is put in the diagnostic manuals to fit for most people, it doesn't always work out. So what are the factors that lead to depression when you're in chronic pain? First, inflammation. For a long time, this part has not played a role in diagnosing depression when in constant or recurring pain. Nearly everybody knows that when we feel sick, we tend to withdraw. Our mood is low, we don't want to do anything, and often enough, we're not hungry at all. Sometimes we even feel a bit sad and just want to sleep. In case of a disease, this is what we call sickness behavior, and it's induced by our immune system. It's a very important function for our recovery so the body can heal. Now, as you might have guessed, the symptoms on the surface are the same as in depression. So sometimes what looks like depression on the outside is actually a sickness behavior coming from the immune response of a body that wants to heal itself. But also in general, we find a higher level of inflammatory markers in quite a lot of people suffering from depressive symptoms. So before you run to your doctor to tell him that your low mood is just all inflammation, please watch the rest of the video to get a better picture. Depressive symptoms are often very general and can have a lot of causes. Pain is associated with low mood. When we experience pain, a complex pattern of activation in our brain is involved. A study of 2017 showed that over 40 parts in your brain are activated. You can find the citation in the description of this video. The signals coming from the spinal cord go up to a region in the midbrain called thalamus. From here, the signals are distributed into different parts, and a lot of them are by themselves interconnected. One of those regions is in the limbic system where mood is controlled. It's called the anterior cingulate cortex, short ACC. Another region that is activated is the prefrontal cortex, especially the part that plays a role when we engage in critical or negative thinking. So you can say we are hardwired to feel bad when we are in pain. This is remarkable because it may save your life when there's a structural damage or an acute disease because you just want to withdraw. On the other hand, when the pain is chronic, it's a source of suffering and frustration. Another part of the limbic system that plays a crucial role is the amygdala, which is an important part when feeling stress and tensing up to anxiety and fear. This part warns us that something dangerous might go on here. So as you can see, by the mere experiencing of pain, we can show symptoms of depression. If you suffer from long-lasting and ongoing pain, these symptoms can become more and more severe and eventually end in a real depression. But wait, there's more to it. I will post the next video on psychological processes in depression and pain in 2 weeks on this channel. So make sure you subscribe and hit the bell. And since chronic pain is such a complex condition to be in, have a look at the video down here. It's your first step to a better understanding of what's going on. And this is really important. Happy to meet you there.